Selenium is a mineral that's found in every cell of your body. It's also in every food that you eat. It's also in viruses and bacteria. Selenium is actually the key element for the immune system. It's difficult if you have a disease or a condition like HIV or TB or Ebola even. It's impossible to get enough selenium from food sources. So it's very easy to take supplements that will bring you your level of selenium in your body right up to the correct level to boost your immune system. Well, as I mentioned, selenium is a key to the immune system. Selenium is part of evolutionary biology. It's been in cells for over 2 billion years. And so at the cellular level in our body, selenium is the active key ingredient for glutathione peroxidase, which is the universal antioxidant that helps clean and detoxify every cell in your body. Glutathione peroxidase does at the cellular level, your immune system does at the level of the human body. And so the cells and the organs of the immune system concentrate selenium because all aspects of the most complicated system in the human body, the immune system, require selenium to work. And so again, if you have enough selenium, your immune system will be strong. If you lack selenium, it's going to be weak. Selenium works to increase CD4 count and also to reduce CD8 count, the suppressor cells. CD4s are the helper cells, CD8s are the suppressor cells. So when you have a high level of selenium, this actually acts at the point of the thymus gland. If your level of selenium is high, you'll create more CD4 cells and fewer CD8 cells. If your level of selenium is low, you'll create more CD8 cells, fewer CD4 cells. I have the simple handmade chart of 21 years of my experience in the MAX study from 1984 to 2004. And it shows my immune system going down. It shows what therapy I was on at any one point, and it shows the dramatic increase that when I added selenium, it significantly doubled my CD4-CD8 ratio, the increase in the CD4-CD8 ratio compared to ARVs alone. That's when I became a selenium researcher. Well, selenium by itself will increase CD4 count and slow the progression of HIV becoming AIDS. There's research from the Ministry of Health in Rwanda, where they put 300 HIV positive patients that were not yet on ARVs, and they gave them one tablet of 200 micrograms selenium a day. That one tablet slowed the progression of HIV becoming AIDS by 43.8%. If they'd used a higher dosage, it would have slowed HIV becoming AIDS by more than 50%. Now, as I said, when you increase the level of selenium, you're going to increase your CD4 count. When you decrease the level of selenium, the CD4 count goes down, the CD8 count comes up. And that's part of how HIV causes AIDS, by depleting selenium from the immune system. As I explain here, that selenium is a reverse transcriptase inhibitor. It is a NF-kappa B inhibitor, nuclear factor kappa binding inhibitor. And NF-kappa B is a human protein that's a primary stimulant to HIV replication within the nucleus of the CD4 cell, and selenium inhibits that. Selenium has also been shown to be an integrase inhibitor and a TAT gene inhibitor. So although selenium is a antiviral element, it gives its primary benefit in diseases by being an immune booster, by increasing CD4 count and making the immune system work better again. Anybody can take selenium. The only people that should not take selenium are people that have had organ transplants. If you've had a heart transplant, if you've had a liver transplant, you are on immunosuppressive drugs. Many HIV doctors don't even know about selenium. The good ones do, but many do not. Selenium is not a prescription drug, so it's a nutritional supplement. So you don't have to see your doctor to get a prescription for selenium. Anybody can go to the pharmacy and buy selenium. They don't need a prescription. Selenium can be taken with any other drug. There are no contraindications. It's like water. It's something that's in every cell of your body. It's a key to good health, really, because a strong immune system is a key to good health. So you can add it to any other drug that you may be taking. There's no contraindication. You can add it to cancer drugs. You can add it to blood pressure drugs. You can add it to HIV and TB medications, and it works perfectly in conjunction. Well, opportunistic infections, or OIs, are something that's very common in HIV disease when the immune system declines, particularly under the level of 200 CD4 count. And at that point, you get opportunistic infections like TB, candidiasis, skin problems, pneumonia, these sort of things that you don't have when the immune system is stronger. So by raising the level of the immune system, this selenium can then suppress the appearance of opportunistic infections. Selenium has been shown to be beneficial in helping suppress these opportunistic infections, including tuberculosis, Kaposi sarcoma, or KS, muscle wasting, heart weakness, hypertension, depression, pneumonia, dementia, hepatitis B and C, pancreatitis, candidiasis or thrush, cancers, liver disease, skin problems, arthritis, diarrhea, organ failure, sepsis, and in fact, theoretically, selenium should help against every opportunistic infection, because by raising the level of CD4 count and the immune system, it therefore suppresses all of these opportunistic infections. They did some research on selenium on pregnant women with HIV in Tanzania. Well, when a woman is pregnant, she diverts the use of selenium toward the developing baby and away from the immune system. So if you do research on selenium when a woman is pregnant, it's not going to show the same effect on the immune system.